Today, health practitioners have the ability to quickly provide an objective record of heart efficiency. From this record, an individual's nutritional status can be evaluated and support can be provided to increase well-being. Almost all diagnostic machines currently in use only provide information on disease rather than wellness. The ACG, however, is able to provide information that will allow the committed individual to optimize his or her health. This concept is revolutionary. No longer does one have to settle for just having apparent symptoms, but optimal well-being can be pursued. The doctor of today has, for the most part, replaced the stethoscope with the EKG. However, the EKG primarily evaluates existing irreversible damage. The endocardiograph allowed heart function to be assessed and recorded. Now the ACG allows an even more complete assessment to be made. Today's health practitioner is returning to the concept that physical health is primarily determined by poor nutritional intake and lifestyle. The ACG can provide information as to how this can be accomplished. Let's look at several specific examples. To do this, you will have to have a basic understanding of the ideal ACG graph. This graph is characterized by 5 typical markers. In marker 1, the first sound, S1, is 3 times the height, top to bottom, of the signal of the second sound, S2. In an ideal tracing, this is approximately 3 large tracing square boxes for the first sound to be 1 large tracing square box for the second sound. In marker number 2, the systolic rest, that's the flat line between the first and second sound, is half the length of the diastolic rest, which is the flat line between the second sound and the beginning of the next first sound. In marker 3, the first sound S1 is approximately 3/25ths of a second in width. Sound S2 is approximately 1/25th of a second, again a 3-to-1 relationship. Thus, in an ideal tracing, the systolic rest is approximately 5/25ths of a second, and the diastolic rest is 10/25ths of a second. In marker number 4, the first and second sounds should be sharp and concise and not rounded and irregular. In marker number 5, the rest period should be almost flat, containing little or no vibrational movement. With these characteristics in mind, we will take a look at how changes in the graph will occur with nutritional deficiencies. In this example, widening of the first sound or both sounds indicates a need for B vitamins. The B vitamins increase the efficiency of nerve and muscle energy conduction. When Bs are absent, the sounds lengthen or become indistinct. In practical applications, a patient with low blood pressure best benefits from Cataplex B, a standard processed product. Conversely, a patient with high blood pressure requires Cataplex G, the opposing fraction of the B vitamin complex. This is a generality that usually holds true, but as there are exceptions, a full understanding of food concentrate use should be acquired before recommending specific B vitamins. Decreased height primarily of the first sound, S1, indicates a lack of efficient muscular contraction. Thus, supporting the growth in muscle tissue with cardiotrophin PMG and or giving the tissue increased oxygen availability with Cataplex E2 provides such support. Increased height in relation to the 3-to-1 pattern primarily of the second sound S2 indicates a need for adrenal support. Blood pressure resistance, which causes the valves to slam shut, results in an increase in the height of the sound. This pattern is most easily recognized when recording the pulmonary valve. To restore a normal sound pattern, the adrenals must be provided with nutritional support. Standard processed products such as Drenatrophin PMG or Drenamin specifically provide this support. Secondarily, Cataplex C increases vascular integrity and enhances adrenal function. In general, patterns with low blood pressure require Drenatrophin PMG, while those with high blood pressure require Drenamin. This is because Drenamin contains Cataplex G, which, as previously mentioned, may act to lower blood pressure. Finally, a diminished second sound indicates a need for increased calcium absorption and utilization. This is usually best accomplished by providing one of the several essential fatty acids. Depending upon the individual, standard processed products such as Cataplex E, Cataplex F, Cataplex D, and Super EFF may provide the needed nutritional support. These supplements may be given with or without one of the many calcium products such as calcium lactate, CalSol, CalAmmo, Calma Plus, or several others. Before we continue, we should analyze current thinking regarding how the ideal sound is created. In this diagram, from page 2-1 of Dr. Jeremy Caslow's publication, Heart Efficiency versus Nutritional Deficiency, we see a depiction of specific heart actions producing the sounds that appear on an ideal ACG tracing. The first sound complex contains an initial spike A, produced by the atria contracting and filling the ventricles up through the open mitral and tricuspid valves. A split second later, the ventricles start contracting, thereby creating a second larger spike B when the mitral and then tricuspid valves snap closed. As the pressure increases, the right and left ventricles, including the pulmonic and aortic heart valves, push open and create a third spike in the first heart sound. The continued contraction of the ventricles expel blood through the open aortic and pulmonary valves during the remainder of systole, as a silent period C between the first and second heart sound complexes. The second sound complex D starts the beginning of the ventricular relaxation. As the pressure in the ventricle falls, two things happen. One, the atria are filled to the point that they begin to push open the tricuspid valve and then the mitral valve, and the blood flows into the now empty ventricles. And two, the aortic and then pulmonary valves snap closed due to the back pressure from the systemic and pulmonary circuits. The amplitude of the second heart sound depends on the amount of resistance to blood pressure. In a silent period E, the blood then flows into the relaxed ventricles of distally, filling each for another cycle. Looking at page 2-3 in Dr. Jeremy Caslow's publication, we see a series of irregular heart tracings. At first, it appears that using and reading the ACG is very difficult. However, Dr. Lee always emphasized functional efficiency. Thus, by just beginning to use the ACG, the necessary knowledge is rapidly acquired. By keeping the ideal tracing in mind, all other ACG tracings can be easily referenced to it. Pattern recognition is the only skill required, and any differences from the ideal needs to be addressed with nutritional support. We will now go quickly down the list of irregular tracings. In this first tracing, we can see a lengthened, indistinct first sound. As we said before, this indicates a need for B vitamins. This second tracing shows another example of this need for B support. Although not shown here, a classic indication of the need for Cataplex G is when the second sound is halfway between the first sound and the beginning of the next first sound. Next, we will see an example of diminished first sound. Cardiotrophin PMG is needed to support the cardiac tissue growth. Here again we see another example of diminished first sound. A second nutritional approach would be to use Cataplex E2 to dilate and support the cardiovascular system. This allows better blood circulation through the coronary artery during dystole. In this fifth example, we see a diminished second sound. As previously discussed, this indicates a need to increase calcium absorption and utilization. As indicated here, one product that might provide this needed nutritional support is Cataplex E. Next, we see another example of diminished first sound. As already discussed, Cataplex C enhances vascular integrity, which provides support to heart efficiency. In this example, we're looking at a very active tracing. Minerals are usually needed to calm this type of tracing. With patients who have an acid pH at the cellular level, this support is best provided by organic minerals. For those that have an alkaline level pH, CalAmmo is the usual choice. This supplement provides the same minerals only in an acidic presentation. Again, this generality does not hold true for all individuals. In the eighth tracing, an enlarged second sound is evident. As discussed earlier, in patients with high blood pressure, this support is best provided by Drenamin. In patients with low blood pressure, this support is best provided by Drenatrophin PMG or any products that contain it. Here is another example of a reduced or absent second sound. Cataplex F is the essential fatty acid product that usually provides the necessary support. In this example of a reduced second sound, the calcium product itself is indicated as a way to provide mineral support to make the heart more efficient.